According to Article 25 of the United Nations Declaration of Human Rights, healthcare is a basic human right. Fortunately, for many countries, this means that healthcare is universal and free for everyone. However, the same cannot be said for the United States. In fact, many U.S. citizens find basic healthcare too expensive and out of reach. In 2018, the total U.S. healthcare expenditures reached $4 trillion, which averages to about $12,000 per person. Good afternoon, I'm Kayla Mondesir, and I have been researching the impacts of the inaccessibility to healthcare on Native American groups. Allow me to give some context. As previously mentioned, healthcare in the United States is largely out of reach for many U.S. citizens, especially ones under the poverty line. And according to data collected by the Economic Policy Institute, Native Americans are largely under this poverty line. In 2015, 26.6% of Native Americans were recorded to be under the poverty line, as compared to the 14.7% of the rest of the population. And in 2016, 26.2% of Native Americans were recorded to be under the poverty line, which doesn't show a drastic change, implying a general pattern of poverty among Native Americans. These levels of poverty can also be attributed to the unemployment rates that Native Americans experience. According to this graph by Brookings, or the Institute of Government Research, for the past 3 years, Native Americans have been in the lead for the highest amount of unemployment rates when compared to Black, Asian, and white people. These numbers pose an issue when compared to this fact that 78% of U.S. citizens rely on their places of employment for medical insurance, according to the Centers for American Progress. And this data, provided by the CDC, or the Center for Disease Control, shows that while 22.4% of Native Americans are considered to be in fair to poor health, 27.3% of them are still medically uninsured. These circumstances have led me to my question: how does the lack of healthcare opportunities present in impoverished communities impact Native American populations? And have found that Native Americans are exposed to preventable health conditions, which leads to higher rates of drug and alcohol abuse when compared to their other racial counterparts. These circumstances both unfortunately lead to increased mental health issues and suicide. As a result of their high levels of unemployment and subsequent uninsurance, Native Americans are at a higher risk for preventable health conditions, as many of them are unable to afford basic health care, let alone preventative care. According to the American Diabetes Association, type 2 diabetes is a chronic disease that is onset by outside situational circumstances. And nearly 1 out of 7 American Indians and Alaska Natives has diabetes, compared to the 1 out of 14 non-Hispanic whites. In the case of Native Americans, these circumstances that cause the increased risk of diabetes comes from the inaccessibility to the funds required for preventative and eventual maintenance care, which according to the CDC costs the U.S. about $1 trillion per year, or $27,000 per person with diabetes, which quickly becomes preventative care quickly becomes an afterthought when compared to many other situations in terms of unemployment and poverty. According to data collected by the American College of Cardiology, compared to non-Hispanic whites, American Indian and Alaska Natives are 30% more likely to have coronary heart disease. Coronary heart disease is caused by plaque buildup in the arteries that supply blood to the heart. And just like how type 2 diabetes is a result of situational circumstances, or in this case, a lack of quality preventative care, so is coronary heart disease. This further implies that the cost of health care makes Native Americans more susceptible to health conditions that could be avoided if given the right medical guidance. The aforementioned risk of health conditions due to lack of funds also leads Native Americans to self-medicate through drugs and alcohol. This data, provided by the National Child Welfare Resource Center for Tribes, shows that 16.8% of Native Americans aged 12 or older were completely dependent on or abusing a substance of some sort, 6% more than the second highest racial group. When compared to the fact that natives make up 1.2% of the U.S. population, these numbers are outrageous. And according to the National Institute of Health, one of the leading causes of drug abuse is to feel physically better, which directly coincides with the lack of funds to get the necessary medical guidance and/or help for the health conditions like the ones mentioned before. Furthermore, this data collected by the Minnesota Department of Health shows that Native Americans stayed in the lead from 2015 to 2016 with 47.3 and 64.6% drug overdose mortality rates, respectively, compared to their much lower numbers of African Americans and white people. Again, these numbers are disproportionate when compared to the number of Native Americans that actually reside in the United States, which further reiterates the point that without actual medical care, Native Americans resort to unhealthy habits for just a glimpse of pain-free living. Unfortunately, with an increased risk of chronic health conditions and subsequent self-medication through drugs and alcohol, Native Americans are exposed to a plethora of mental health issues and ultimately high suicide. This infographic by the National Indian Council on Aging points out just how many Native Americans are subject to mental health illness. It restates just how small the Native American population is and compares it to the 21% of them that had diagnosable mental illness in the past year, which is over 830,000 people, or enough to fill every Major League Baseball stadium in the East Coast twice. If you'll notice, this infographic strategically uses the word diagnosable rather than diagnosed to point out that generally Native Americans don't have access to mental health care, as this is often a luxury and an add-on to the basic health care that are already difficult for them to gain access to, which means that they remain untreated. Generally speaking, remaining untreated for any disease is bad, but especially when talking about mental illness. According to the National Institute of Mental Health, suicide is the leading cause of death among adolescents aged 15 to 24, which is reflected in the graph by the National Center for Health Statistics. Once again, Native Americans are depicted in the lead, but this time for the highest amount of their 18 to 24-year-olds dying by suicide. This further connects the points of drug and alcohol abuse, as oftentimes people who commit suicide see death as the only way out of cyclical systems like substance abuse. To conclude, the U.S. government has done very little for Native Americans when it comes to the healthcare system, and a quote by Nelson Mandela in his book A Walk to Freedom depicts the lengths at which Native Americans have had to go in order to close these gaps. It reads, "We supported each other and gained strength from each other. Whatever we knew, whatever we learned, we shared. And by sharing, we multiplied whatever courage we had individually." Through organizations like the American Indian Movement, Natives have been successful in establishing the Legal Rights Center to provide representation to the poor in their communities, as well as the Indian Health Board to advocate for themselves, proving that although the gaps are wide, Native Americans are working together for the better of their communities. Thank you.
Two questions for you. First, how did your research question evolve as you moved through the process?
At first, I wanted to focus on the different groups within Native Americans, so like children and elders or women, but I found that, like I said, they only take up 1.2% of the population, so in order to talk about those specific groups, like the research is very limited.
Okay. And what additional questions emerged as you were going through your research?
As I was going through my research, in the beginning I alluded to the fact that unemployment and poverty are hand in hand, but through my research I wanted to research more and ask questions about what actually causes the unemployment that relates to the poverty.